Have you ever wondered what is the real cause of your tinnitus? There are many different causes, different subtypes of tinnitus. As an audiologist, this is a topic I have researched, and that led me to meet Dr. Michael Golenhofen, ENT doctor in Germany, who has extensive knowledge and has published research on the different subtypes and causes of tinnitus. Dr. Golenhofen, can you please explain the 10 most common types of somatic tinnitus, how you found this, and for those who don't know, what is somatic tinnitus?
Yeah, thank you for asking, and thank you for having me on your podcast. As a matter of fact, the somatic subtype of tinnitus, it has first been published in 1993, so it's quite a long time ago. And there has been collected an enormous amount of research on this disorder, type of disorder causing a tinnitus perception, first. Second, for a clinician, it is not so difficult to actually realize that this patient could exhibit a somatic subtype of tinnitus, because the moment we carefully listen to the kind of symptom, we can find out pretty quickly. The somatic subtype usually generates a monolateral tinnitus of a high pitch, most often, like 20%, it's a low pitch hissing. But mostly it's a high pitch sound that is not the same all the time, but that changes very much. We have good days and bad days. And this is the way it behaves. And in this characteristic, it differs from other subtypes that have a much more constant type of tinnitus perception. So these are the ways a patient describes as a symptom of tinnitus that belongs to the somatosensory subtype. And when we look up the literature, we often found the neck problems and TMJ masticator problems as the causes. But as simple as this somatic subtype actually is, because it is only the way from the masticator muscles, from the neck muscles, from the head, bones and muscles to the human brainstem, where the non-auditory information is mixed up with the auditory information from the inner ear. And when the mixture of both is kind of dysfunctional, then we hear a high-pitched tinnitus sound. So it is a pretty simple form of tinnitus, but at the same time, the causes, the different conditions that can produce it are so many and also very difficult to find out. So I tried to make some kind of list of those different conditions. And it, for example, in younger people, it often, the history starts with an orthodontic treatment in childhood. Very often, with pulling premolar teeth during an orthodontic treatment, leading to a non-satisfactory kind of result, and then ending up with some wires between the front teeth called retainer that try to keep the teeth in a certain position, at the same time producing an extremely high level of distress in the maxillary system, leading to form of sensory motor loss of integrity and then to a tinnitus sound later. So orthodontic treatments is for sure one of the important reasons. Then any kind of inflammation in the head and even neck area. We're talking about teeth, root canal treatments that are not okay. Inflammation of the tonsils, states after surgery of the tonsils, leaving scars in the palatine and the pharynx, and also sinus infections. Any kind of trigger that raises the firing rate in the trigeminal nerve going to the brainstem. Then, of course, dental conditions, extracted teeth with loss of support on one side of the bite situation, leading to a rotation of the lower jaw into a TMJ, giving some kind of compression symptoms. So anything that happens in the masticator system in the TMJ, which is a very sensible organ, of course, is very often the reason for a tinnitus onset, usually linked to the typical history. I went to a dentist, I had a dental treatment. 6 months later, even to 12 months later, I had my tinnitus onset. I mentioned the surgery, the scars in head and neck. Then, of course, accidents, now a little bit lower in the neck area. Sports injuries, car accidents, whiplash trauma, leading to some kind of, we call it the trauma reflex. When muscles are stretched one time, they develop some kind of reflectory tension, that gives some kind of asymmetry to the whole neck situation. So any kind of accident, even down to the shoulders, to the trunk, leading to scarification or to muscle disbalance. At the same time, even injections into the shoulder blade, into the shoulder, into the chest area, into the neck, into the head, can cause this type of sensory motor integrity loss. And I mentioned the chronic inflammations. And then, of course, histories of a very monotone kind of sitting position at the workplace. I always have to turn around to my left side. Maybe my computer is there, or some kind of asymmetric situation over years can lead to the loss of the sensory motor integrity, and then later, even lead to this type of somatic tinnitus. So in this subtype, it is extremely important to just communicate. We need to find the trigger. And when we have realized where the trigger is, we need to repair the situation. This is sometimes easy. You just need to treat the scar or the inflammation and so on. And sometimes it is extremely difficult because especially dental treatments, they cost a lot of money. Neither dentists nor patients want to change anything because it was so expensive. The dentist doesn't see anything wrong in their eyes. But at the same time, when we are sure that this is the trigger, it is difficult to communicate. We need to change your prosthetic that you paid a lot of money for. And sometimes a couple of days ago, I had a patient with a somatic tinnitus deception. And I always have an X-ray of the teeth, panoramic X-ray, where I look up the tooth situation. And there was one tooth I was not really sure, but the dentist said, no, I don't see anything. And then he even got some hearing losses over and over again on this ear. Then we finally decided to do a 3-dimensional X-ray of the tooth. And there it was, inflammation that was not visible on the first X-ray picture. Tooth was removed, tinnitus gone, hearing loss situation's gone. So it took me months.
That's impressive.
So sometimes it is extremely difficult.
Yes. Great
Still
job.
Difficult.
Great job on that case. Would you also say pulsatile tinnitus fits into this category?
No, it doesn't.
Okay, that's separate.
Pulsatile tinnitus is a objective form, blood vessel related form.
That has its own list of potential causes. That's perhaps another video, right?
That's another video. And fortunately, the pulsatile tinnitus forms are so rare. I try to look it up. It's below 0.5% of our patients. So it's just so rare, fortunately.
Yes.
But it's another one.
Dr. Michael Golenhofen, thank you so much for sharing your expertise about the different common somatic causes of tinnitus. With this information, we encourage individuals to ask for help, reach out to a tinnitus specialist, reach out to an ENT physician to help get closer towards treatment and finding the right treatment based on your cause. Dr. Golenhofen, thank you again for being here on the Treble Health Podcast.
Thank you very much for having me.